Hi, everyone. My name is Ramya Radhakrishnan. I am a third-year medical student at Miami Miller School of Medicine, and I am on the Physician for Human Rights Advocacy Committee. Today, we are so honored to be able to talk to Dr. Sarah Kimball. Dr. Kimball, if you could introduce yourself briefly.
Sure. So my name is Sarah Kimball, and I'm a primary care doctor at Boston Medical Center. And I also co-direct our hospital's Immigrant and Refugee Health Center. And I'm on faculty at Boston University School of Medicine as an assistant professor.
Great. Thank you so much for speaking with us today. If we can start off just by, if you could tell us a little bit more about the work you do.
Yeah, so I think of myself as mostly a clinician. About half my job is direct clinical care for patients. And Boston Medical Center is one of the largest safety net hospitals and primary care facilities within all of New England. So that means we're taking care of a lot of folks who are below the federal poverty line, and in my particular job, a lot of vulnerable immigrant and refugee populations. So about half my work is direct clinical care, and the rest of it is really focusing on building the Immigrant and Refugee Health Center and running that, which is a medical home that's specifically focused on meeting the complex needs of immigrant and refugee populations across our hospital.
And could you tell us a little bit more about how you got involved in this work and kind of the first steps you took in getting involved in a career related to human rights?
Yeah, it's a very good question, because when I was looking both at residencies and then again at jobs, I was thinking of myself as someone who wanted to be a human rights internal medicine doctor, which is not really a career path. It's not really a thing. And so initially I thought I might do global health. I considered doing public health, all of which had pieces of what I wanted to do. But I really found my voice initially in doing some legislative advocacy work. So there was a state bill that was focused on medical licenses and whether we should be, as a state, holding people accountable if they were medical professionals who participated in torture or harm. So this was working on Guantanamo and trying to hold people accountable who participated in enhanced interrogation. And I found that I really enjoyed doing advocacy work directly on a state bill, which is, again, not a medical skill that we traditionally focus on in practice. But for me, the combination of a health-based activist issue and the credibility that we have as medical professionals was a really interesting mix of the possibility for using our medical skills to further promote human rights and ethics. So that was really my first step into advocacy work, particularly in the greater scope of what I think of now as my career domain, which is immigrant and refugee rights.
Absolutely. And kind of along those lines, what would you say have been some of the greatest challenges you've encountered in this career path, and specifically relating to your asylum and refugee work?
I think it's no surprise to anyone that this particular moment is a very tough moment in the world of immigrant rights and immigrant health. And so the hardest work for me is when I see the ways in which the political has direct ramifications on the health and healthcare access for my vulnerable immigrant patients. I find it really rejuvenating to work with all of my patients, but it's hard when someone doesn't have a viable pathway for immigration or for citizenship, because that means they don't have access to some of the basic services that we know help keep people healthy, like full insurance or housing benefits or food benefits. So for me, I am most challenged when I meet impenetrable barriers in healthcare access and social service access for my vulnerable immigrant patients. And unfortunately, that's all too common these days.
And related to what you said about the political landscape, obviously we all know there are some major changes in just how we view life with COVID going on right now. We were wondering, with respect to the work that you do, have you been seeing any changes with regards to maybe the flow through your clinic or the patient population, demographics, anything like that?
Certainly. Well, so as our country has been taking fewer refugees into the country itself, we, of course, as a clinic that takes care of refugees once they arrived, have had a dramatic decrease in our numbers. So again, I worry about those folks, because just because they didn't make it to the US and didn't make it to our clinic doesn't mean they don't have distress and medical problems. And they're just so far out of our reach and our scope of influence. The other thing that we're seeing during COVID is for our patients who are here, many of them are in particularly vulnerable first-line jobs. So we have a lot of folks who work as essential workers in food services, as CNAs, as first-line healthcare professionals. So I worry that many of my immigrant and refugee patients are actually some of the most exposed. Meanwhile, while they're the most exposed, they're also the ones that have, in some ways, the least access to other services. So if you need to go to work because you can't afford not to in order to pay your rent, you're more likely to put your own health and body at risk.
Right.
So those compounding vulnerabilities of economic pressure, of immigration pressure, of COVID really have come together to be a particularly damaging social determinants of health disaster for many of our immigrant patients.
And, you know, as many of our listeners and viewers are medical students, are there ways that you think we could be useful in helping in this setting, whether it be through a clinic or any advocacy work?
I think it's great to know what opportunities are available at your institutions. Many institutions have programs that specifically work with immigrant and refugee patients. And so I would encourage you to make sure you know well about what resources you have within your own institution. I would also say as medical students, you can work on larger national organizations. So obviously Physicians for Human Rights has a wonderful presence with students. And then you can learn some of the critical skills that will help you do human rights work once you've finished medical school and residency. But there's also other organizations. And I would say, for example, in Massachusetts, there's an organization called the Massachusetts Immigrant and Refugee Advocacy Coalition. They bring together all sorts of immigration and health experts. And so it's worth knowing who are the players doing this kind of political work within your own landscape, because many, many times they're going to be the ones who have the most up-to-date calls for action to call your senator. They're going to know about state legislation that's important in your local community. And so I think if you're interested in these issues, knowing what's going on in your city and your state, and then finding the organizers who are doing that work and lending your voice to them is one of the most critical ways that you can be helpful. As a medical student, you are a health professional. You get to have the credibility of coming in as a health professional and lending your societal respect and stature to the causes that you're willing to speak about.
Absolutely. And when you were in medical school, were there any organizations that you found, whether it be Physicians for Human Rights or other student advocacy groups that helped pioneer that interest for you?
Mm-hmm. I felt like for me, the most important thing was really local advocacy physician groups. And so I started going to a dinner series that was put on by activist physicians in my community who had spent their whole careers really as champions for things like single payer healthcare. So it's funny, for me, more than a formal national organization, it was about finding this group of people who thought of advocacy, activism, and equity as 100% within the scope of their medical practice, and then learning from them. Some of them did research, some of them did clinical care, some of them did advocacy, but seeing the range of ways in which people used their medical degrees and medical knowledge to promote equity was, for me, the most inspiring first step.
And just kind of speaking holistically, is there any lasting advice you would want to give to students that are watching this right now? Obviously, with all the changes going underway with healthcare and our student experiences, just kind of any tips or advice you have.
Yeah, I think the number one thing I can say is to find your people. At any healthcare institution, at any medical school, you're going to find people who think of equity and advocacy as part of their scope. And hopefully you'll find those people within your medical school colleagues, your residency colleagues, but then looking for faculty who think of that as part of their job. That for me was just the most critical thing, to be able to see people whose careers were things I could envision modeling. And that allowed me to have the creativity to vision what my own human rights medical career could look like. So I think it's just so important to find your people wherever you are.
Absolutely.
I think it's critically important to call your senators, call your state legislators, and to use those things. Feel like they're very small interventions, but when you apply them to the issues that are most live in your community, and when you call the places where you are actually a constituent, you have an outsized impact. And so get involved in the local landscape of politics. I think that's where you have the biggest ability to use your voice and magnify your impact.
Absolutely. Well, thank you so much, Dr. Kimball, for taking the time to speak with us today. And for everyone watching, we will leave the link to the Immigrant and Refugee Center that is at Boston Medical Center, so you can learn more about their work if you're in that area. But thank you again.
No problem.